many residents talking about toxicity in their workplace. Their senior behavior, ragging, multiple issues are there.
And if a resident is not happy, please be sure about it that in the future he cannot be a happy consultant.
So do you think like putting some work structure, a day structure would actually help our junior residents?
See, residency is not only study, it's a job.
Entering into residency, how to tackle the stress, the toxicity.
Too much dedication is also bad for doctors, junior doctors particularly.
So what are the future potentials for an ENT surgeon?
The ENT people now can do MCH plastic, the surgical oncology, between head and neck oncology, and the neurosurgery also.
You left radiology for ENT.
That's why radiology did not attract me.
If a student is getting a choice between a good state government college or a peripheral AIIMS, what he or she should choose?
If the state government college is doing, you should go for the state medical college.
How much does an ENT surgeon earn? Ear is the avenue to our heart. This is what they say about an ENT doctor. So today we have a very special guest with us. He has been a graduate from Amritsar Government Medical College, MSc from Lady Hardinge Medical College, and a DNB himself. He has been teaching NEET PG and FMG graduates from last 20 years. Has done some amazing things in this field and is a staunch believer that FMGs should be treated fairly in India. He has been a torchbearer for FMG rights. I believe you guys all know who I am talking about. He is the great Dr. Rajiv Dhawan. With Dr. Dhawan, we are going to untangle ENT as a subject, as a postgrad branch. How much can an ENT surgeon earn in India? What's the difference between MSc ENT and DNB ENT? Top best institutes for MS and DNB ENT in India, and what should be the right steps to correct the FMG welfare and treatment in India. Let's put our hands together and let's welcome the legendary Dr. Rajiv Dhawan. So welcome Dr. Rajiv to our show.
Thank you very much.
So sir, thank you so much for taking out time. So let's start with your journey. You have been educator for almost 20 years now. So how did an MBBS graduate from Punjab moved on to becoming one of the best ENT educators in the country? So we want to know your complete journey.
Definitely. Thank you very much, first of all, for inviting the show. I'm from Amritsar and I did my MBBS from Government College Amritsar. For PG, I came to Delhi. And I must tell you at the outset that, I left radiology to take ENT. People might say that, are you crazy or what? But I was probably too sure about it. Because when you leave radiology, you leave medicine, surgery, orthopedics. But I had only 3 branches in my mind, eye, ENT, psychiatry. That's all. And I'm really glad I took ENT, a lot of work-life balance. And then, of course, teaching happened. LHMC was my training institute. And after that, I was in AIIMS Delhi for almost 2.5 years. And the medical education has been, I would say, icing on the cake for me. And I'm really glad that, this opportunity came my way.
So how was your journey as an educator?
I started my journey with DAMS in 2004. And now I've completed 20 years, actually. It has been a wonderful journey. And the reason I say that is that this is what probably I was designed for. And I was not aware about this. Sometimes you feel profession chooses you. You don't choose profession. Because, a guy from Punjab, in Punjab, study is extracurricular activity, you know it. And a Punjab person teaching someone, it's not a really great idea. But it was totally, I would say, serendipity for me. And the journey has been wonderful. I was, first of all, dealing with the NEET PG mainly, INI-CET part. And along with that, I started doing FMG segment also. I'm traveling all across India and overseas locations also to interact with the medical students.
So boss, you just told me that you left radiology for ENT.
Yeah.
Any specific reason for that?
I did my internship properly. And while I was doing internship, I passed, through multiple departments. And after every, department finish, I would just think that, do I want to do this? Do I want to do this? The answer is no. Not that I was not really keen to work that aggressively, but I was not seeing myself in that role. And radiology must be a wonderful branch for a lot of people. But for me, it was behind the, show kind of scenario. And I'm a people person. That's why radiology did not attract me. And why Optha, ENT? The reason was that a lot of work-life balance is there, and it was an end specialization for me. And while leaving radiology, I must tell you, the counselor sitting in front of me, she said, "Are you really okay? Because a rank below 500 and you want to quit that and you want to do something which people will not take." She said, "Take your time, decide, take a glass of water, and now tell me what you want." I said, "Ma'am, ENT only." She said, "Why ENT?" I said, "I'm really sure about it." She said, "Any other branch you have in mind?" I said, "Ophthalmology." She said, "Okay, take ophthalmology. It's a better branch." I said, "I can't take ophthalmology." She said, "Why?" I told, "My girlfriend took ophthalmology in PJ Chandigarh already." She said, "Are you sure she'll marry you?" I said, "Ma'am, God decides, but I'm prepared for that." So that's how I chose ENT.
So did she finally marry you?
Yeah. She's my only wife, latest wife, current wife. Yeah.
Okay, so you have done your postgrad from LHMC, Lady Harding,
Yeah.
one of the best institutes in the country.
Yeah.
So how would you describe your residency days?
Residency days, when a person comes from Punjab to Delhi, there was a huge shock, let me tell you. The first 2001, 2 I'm talking about, it was a shock for me because I was coming from, like Punjab. Delhi has a different culture, and I must tell everyone that when you join residency, first 3 months, please give yourself to absorb the place also, because you might not like the place that way. But today I'm in love with Delhi. People say Delhi has got AQI, this and that, but still I love that AQI also, because I totally love Delhi with the way it is. But first 3 months were really tough for me because I was adapting to the new kind of working environment. The residency training was really amazing, I must say. The kind of exposure I got over there, the kind of patient load they had, and the most important thing was the pediatric otolaryngology. It was very intense over there because they have a specialized pediatric hospital over there. And then after my LHMC stint, I joined AIIMS Delhi. So that was really further polishing my skills. So God has been kind, I would say, to give me a lot of opportunity to learn from many good professors over there.
Today, I've heard many residents talking about toxicity in their workplace.
Yeah.
Their senior behavior, ragging, multiple issues are there.
Yeah.
Did you feel those kind of issues back in your days as well?
It has been part of every resident life, whosoever does PG from any institute, because every person is not same. In the department, a different kind of people. So unfortunately, this kind of insecure working environment is becoming universal across the country. And it's a matter of major concern for all of us. Because when we see residents, they're future consultants. And if a resident is not happy, please be sure about it that in the future, he cannot be a happy consultant. And if a patient comes to a person who is not internally happy, the delivery of the service will not be that great. So, Nachiket, I must share with you one thing which is very close to my heart too. We must start something in the country, happy residents. Resident must be happy because residents are the pillar of department and they should be taken care of by the professors in a very meticulous way. Because, for example, a resident who has done duty for the last 36 hours, when he's going back, a word of acknowledgement from the senior professor that, "Are you guys doing well? Because you did not really take rest for the last 36 hours. It would give encouragement to that, PG for the next day. Because at the end of the day, they're also human beings. But that element, I want to really say very clearly, is lacking. In not everyone. Some seniors are very good, I must say that, but majority people are passing on whatever they suffered to the next generation also. So that creates a big problem. And I think rather than we pointing fingers at anyone, we should take it like a collective effort on the part of medical community to do some dramatic changes, big changes in the way we are treating our juniors so that we're able to produce the happy junior doctors. Because people say happy Doctors Day on 1st of July. But I always ask on that day, are doctors really happy? Are junior doctors really happy? If you ask most of the interns, most of the PGs, they are passing through a lot of turmoil because they joined the PG after passing such a tough exam. And now when they reach these departments, they see that they're not being treated properly. And I think there is a huge requirement to bring that change in the mindset of the seniors to take care of juniors so that we ensure happy junior doctors, because that will be the beginning of very productive consultant of the future also.
Boss, do you think that not just a good word, maybe changing the timings and day schedule of these junior residents can actually help, because a 36-hour duty is inhumane.
Yeah.
And when you think, I mean, when I tell anyone who is an outsider to the medical world, I tell them that okay, ड्यूटी होती है, फिर 36 घंटे काम करना होता है, they are shocked.
Yep.
So do you think like putting some work structure, a day structure like corporates would actually help our junior residents?
Absolutely. Why not? See, residency is not only study, it's a job. Now, Sweden talking about 4 days week culture. They are very particular about it, you know it. And when we talk about doctors, we have to deliver the services to the clients who are coming in despair over there. For that, we should be mentally fresh. You must have been seeing a lot on social media, fights going on between the patient attendant and the doctors. The reason is, at the end of 36 hours of duty, can you imagine a patient coming to us? Would we like to smile and serve that patient? Not at all. And you're absolutely right in saying this. We must have a structured program, how much work residents are supposed to do. And why it is happening is that, number of residents are still, less in the department. Like, for example, ops gynae or pediatrics, orthopedics. Maybe we require 5 first-year PG in one unit to carry out the ward work, OPD work, and the emergency work. But we only get 3 PGs in one unit in one session. So that work gets distributed to the other people. So it's absolutely mandatory that we must put a restriction that beyond this you cannot work. For example, pilots cannot fly beyond a certain number of hours. They will park the plane, they say, my hours are closed. You know why? It's a sensitive job. I have a question to everyone. Is dealing with health is not a sensitive job?
Dealing with life.
You are dealing with life. Is it not a sensitive job? And when pilots cannot fly, why can't you say about doctors too? Just put a full stop there. The other person will replace you now. That is the way to correct. And Nachiket, I must really share one thing with you. India must not copy any Western country. We are 140 billion people. Every 6th human on the planet is Indian. Till the time we keep copying the norms of other countries, we'll not be able to work it out. We should say out loud and clear to everyone, we need a lot of doctors in these hospitals. Then only we can decrease the number of hours every resident is actually working for. That would give this resident some time to take rest and get charged up for the next day and then serve the next patient with a smile on the face. That's what we are hoping for.
That's a very sound reason that you just gave. And that's a true logic behind that. Yeah. If pilots can have that kind of comfort, if people who are dealing with human life, why they cannot take a break? Yeah. That's very logical. Yeah. Boss, what will be your suggestion to a new JR1 who is entering into residency, how to tackle the stress, the toxicity, and maybe unhealthy, unemotional seniors?
To all the first-year PGs, I would like to suggest one thing. Please take care of mental and physical health. You have not joined gym for last many, many months or maybe a year because you're preparing for NEET PG. Maybe you're repeater, 2 years you did not work out at all. Please take out some time. I know you'll say, Dr. Dhawan, duty is very hectic. You join the gym, go for 1 day or 2 days. Go for a jog, whatever you want to do. Please get some time out of the working environment and just chill out. If you want to go to a pub or a restaurant, keep 1 day for yourself because this residency is something you are waiting for when you prepare for NEET PG INI-CET. You got it today. Now you are getting some money also, hopefully. Please take care of yourself. That's the most important thing. People say be sympathetic towards patients. May I differ? Please be empathetic towards patient. And most importantly, please be sympathetic towards your own self also. Because if you don't take care of yourself, believe me, the fatigue will come faster. We are not 2020 players. Too much dedication is also bad for doctors, junior doctors particularly. Because we expect, our juniors to leave everything in life and just be in the ward every time and take care of patient only. But we forget they're also human beings. They need to take care of themselves. So I will encourage every first year PG to be very clear that even if the environment of the department is toxic for me, I would not let that erode my mental attitude or personality, I would take some time out of that environment and create my reasons to feel happy. And that would be a voluntary effort. Like for that, you need to walk an extra mile. And that you must do that. I'm telling you, second year thesis will come. You'll have another reason to be busy now. But if you create this habit to go to gym at least 1 or 2 times in a day, in a week, sorry, or maybe you party around, you take some, like some opportunities to, go away from that toxic environment, you will feel that I am learning gradually how to tackle this whole thing. Because every senior is not same. There's some seniors who will understand you also. If you go to them, then can I take half a day off this Saturday? They will approach those seniors, find them out, go out with them, and be with them. They will certainly help you.
So basically, good networking is something which a JR1 should consider
Absolutely.
the moment he steps into the new place. That's actually true.
Yeah.
So boss, please describe us the pros and cons of ENT.
See, ENT, the biggest, I would say, advantage is its end specialization. And many fellowships are there now. You can diversify yourself into nose surgery, laryngeal surgery, ear surgery, implants are there, and multiple things are there. The cons are, people say, there is saturation. And Nachiket, I must say, in a country of 140 million people, where only Uttar Pradesh has 7 Canada into it, let's not talk about saturation. If you like this branch, I'm sure you'll find a way. Yes, the curve will be a little slow, but once you reach a like a stable platform, you'll be earning money for a very long time. But yes, you will find lesser number of opportunities visible all around, particularly in the metro cities. In the tier 2 cities, again, you get a lot of opportunities. Slow growth, but sustained growth after that.
So apart from the fellowships, now I think MCH also has been introduced for ENT. So what are the future potentials for an ENT surgeon?
The ENT people now can do MCH plastic, the surgical oncology, particularly head and neck oncology, and the neurosurgery also. So if you prepare for the NEET SS, you can join either of these branches, which is a wonderful thing.
What are the possibilities of an ENT surgeon working abroad? Australia, US तो US MLA हो गया, but Britain, Australia, what are the chances there?
Like for example, you want to go to UK, you appear in the MRCS ENT examination, like I've done it, and then you go there and you work as a trainee registrar over there. Yes, you'll have to repeat your training over there, and then you appear the Royal College exam, you can work as a consultant over there. Same with Australia also. But yes, you should know that opportunities for ENT Ophtha are limited, because outside ENT and Ophtha are most sought out branches actually.
When we were talking about saturation, I believe that tier 2 might not be saturated, but I have heard a lot of students talking that tier 1, like Delhi for example, is super saturated. Now, is that particular part true?
Absolutely agreed. Tier 1, you will have problem. For example, you do PG from Lady Harding. You won't get SRship immediately in any of the medical colleges over here. So that's called saturation. Versus you do, for example, in radiology, you do the PG, you get SRship very easily. But if that is saturation, yes, that's a problem. And in the corporate hospital also, you will find little difficulty in getting the first placement. But tier 2, it's really easier to in fact make your mark over there. So to the juniors, I would say, learn from the best institutes of tier 1 and settle in tier 2. That would be a wonderful thing. Take the good services to the tier 2 and become the champions over there.
Boss, if I ask you, like top 5 institutes for MS ENT in our country.
The first will be AIIMS Delhi, second PG Chandigarh, then is CNC Vellore, and fourth is JIPMER Pondicherry, in my understanding. Fifth is Delhi colleges like LHMC, MAMC, UCMS, and other colleges in country like BJMC, Ahmedabad is wonderful, and many other colleges I may be forgetting. But these 4 definitely are like pinnacle, because they are doing a lot of good work, and people get surgical work there. Do people have this concept that in these colleges, juniors don't get work? I worked in AIIMS Delhi. I saw the second year PG, third year PG doing wonderful surgical work. So don't worry about that.
If apart from AIIMS Delhi, are the peripheral AIIMS also worth the tag?
Few peripheral AIIMS are now doing really good job in ENT. I would like to name like Bhubaneswar is doing good. Jodhpur is doing good. Rishikesh is doing good now. And gradually, I think with the capacity building going on gradually, we'll get many AIIMS doing great job over there. But these are the good institute right now departments as far as the ENT is concerned.
If a student is getting a choice between a good state government college or a peripheral AIIMS, what he or she should choose?
If the state government college is doing good amount of surgical work, patient load is good, and the second year, third year PG are getting good hands-on training, you should go for the state medical college. Don't go for the tag even, because at the end of the day, please imagine yourself what you're doing. If you are a private consultant, the skills will matter a lot.
Between MS ENT and DNB ENT, would you count them as equivalent or is there any difference?
See, as far as ENT is concerned, most of the institutes in DNB are not able to give that much surgical work, except for few, as per the MS. That's a problem, definitely. But in certain specialties, like for example, you say MD dermatology versus DNB dermatology. Maybe DNB dermatology may be better than MD dermatology because the cosmetology part will be better in the corporate hospitals over there. So if you talk ENT, I would say prefer MS. But if you're not getting, scan the choices like Gangaram Hospital in Delhi, St. Stephen in Delhi, and the couple of hospitals in Mumbai, they're giving good surgical hands-on also. So better would be go there, talk to the residents and consider that option if ENT is your choice.
Boss, there is always this kind of perception in the market that ENT is not as glamorized as medicine or surgery. So how would you like to change that perception for us?
I'll give you an example. A child has got profound hearing problem. Totally deaf child. You put an electrode in the ear of that child surgically and the child start hearing. Do you think it's really glamour? This is the medical glamour, you know what? That's what ENT is. So what we should do, when we look at the subject, if you like that subject, just find out what is going on in the corporate hospitals also, along with the government ones. What is the recent thing going on over there? Because nobody can imagine ENT surgeon operating pituitary adenoma, but that's what the norm is in Delhi right now. Nobody can imagine that ENT surgeons are doing fancy cancer surgeries and all that, but a lot of my colleagues are doing head and neck cancer surgeries. So the glamour we have to create. The skill you will learn, but believe me, to create the glamour, you should have passion to create the glamour, and you will create it.
Was how a student should choose the best ENT college. Like what are the key parameters they should look for so that they can choose that, okay, this college is really good for ENT?
Number one would be the department environment. I always keep that as number one because it should not erode your personality. There are some departments who are really, really having phenomenal work, but the interpersonal things are not really great. I would say go to step 2, level 2 choice is okay if that's one. Number 2 will be, of course, the surgical work. Talk to second year, third year PGs, how much work they're getting. Because at the end of the day, we are surgeons. So, like if you are not getting the proper surgical exposure, you will feel, why did I choose it? Number 3 would be the academics. Number 3, because some departments are doing every week some academic activity. They promote this. And that environment in the department. Number 2 is the surgical training part. And number 3, the academics. These are 3 goalposts for me actually.
And now I think, boss, this is the time that I'm going to ask you the favorite question for our podcast. I think the students love it. So I'm going to put it out and I want you to give your best answer possible here. And the question is that how much does an ENT surgeon earn? And I want you to, bifurcate your answer as a fresher, as a mid-level experienced guy and a senior doctor.
The first passed out student, like you are doing residency now, SRship now starting, you will be earning around maybe 1.5 lakh if you're working in a metro. If you are mid-level, you have done like 3-4 years of your practice and you will be making close to 4 to 5 lakh. But if you are a senior doctor, like you are a consultant, you're in like premium hospital, you are the in charge of department, then your earning range will start from 10 lakh to maybe 1 CR plus. So that's what the thing is. But a lot of my surgeons, friends who are really doing very good job, this is what they are earning.
Is there any business opportunities in ENT?
The business opportunity in ENT is that you can diversify yourself into developing clinics for tinnitus, for example.
Okay.
The ringing in the ear. It's a big problem. You can develop that as a solo business for you and you can invite the vertigo and tinnitus joint clinics. They can be offshoot. With the hearing aid, you can employ an audiologist and you can develop that as a parallel business for yourself.
So boss, let's talk about the NEET PG 2025. The exam date is always
Yeah.
uncertain these days. So what would be the best strategy for a student preparing for 25 exam to crack it in the very first go?
Keeping the hypothetical date in mind of April second week, let's prepare wholeheartedly. NEET PG is something which will decide the quality of life for the next 30, 40 years. Let's be fully devoted. That's the only word I have. Don't study less than 10, 11 hours every day because you have to do that. This is important exam. Most probably, most of us will be reading this kind of intense information last time in our life only. Please read it totally, honestly, with full devotion.
I'll go off topic for a second, and I'll ask you, what will be the three reforms that you would like to put in the medical education?
Number one, I would like to make it crisp. This 5.5 year is too much. We can make it a little bit more crisp, number one. Number two, I'll encourage these student exchange programs. We should have within the country, let's promote student exchanges. We should invite people to do some subjects to this, to that college also. It will encourage people to travel to see places to get the other perspectives also. Third is that the clinical training part should be taken more seriously by the students and by the teachers also.
Great. Very good points, actually. Let's move back to the NEET PG part. So what should be the revision strategy for a student? What are the key points that they have to consider while revising for the exam?
The first reading should be finished by the end of January. If you're starting in December, now please finish the first reading by the end of January. In the month of February and the mid of March, do one more revision. In the last part of March and the early days of April, do the last look. Multiple quick revisions are better than single exhaustive revision. We have to keep in mind. So strategize for 3 revisions, but do them faster.
How many revisions do you advise?
3.
Minimum.
Definitely, but quick revision. Let me tell you a secret. Even if you read slow or if you read fast, the speed of forgetting is same. So multiple time reading the data, but faster way is going to really create more benefit for you. Provided your mobile phone is away from you. If your phone is with you and you're reading PSM, there is a histogram topic going on. On the phone, Instagram topic is going on. Histogram stands nowhere. Multiple quick focus revisions are better than single exhaustive revision.
Boss, what's your opinion about next?
Next is the national medical confusion.
I think ENT, Ophthalm, and PSM, these are the 3 biggest, boomers in next. From 10 questions to 60 questions. Like, how would you change your teaching style, the content? हम खुद हैरान थे कि 10 से सीधा 60 क्वेश्चन जा रहे हैं. इतना बड़ा कंटेंट में चेंज कैसे लाएंगे? So what would be your suggestion as a faculty?
Kidney will remain kidney only. It won't grow and become brain one day. So topics will remain same. But yes, we'll include some more topic as per the competency guidelines. That's what we'll do. We'll make it more integrated, clinical, conceptual. And we'll make the people practice the multiple choice question, clinical scenarios within the class. That will be the biggest change in the teaching methodology. We make sure that they do the clinical vignettes with us in the class because that's what the paper of next will be.
Like, give me an example, like this topic, for example, CSOM. If you are teaching today in, let's suppose, 15 minutes, in next, how long will that content go now?
Yeah. For example, I'm teaching the middle ear infections, maybe in 35 to 40 minutes. Okay. I'll have to take approximately 2 hours for that because the examiner would be getting now more opportunity to ask the question out of these topics because at this moment, 10 question out of ENT in NEET PG means the examiner is restricted to otosclerosis, cosyndroma, angiofibroma, cochlear implant, glomus tumors, and the story is more or less over. But when you go to 60 questions, you will start going to nook and corner of that topic actually. So the teaching would change, but the major change would be the conceptual orientation in the class. We'll have to make them practice for sure.
Do you think next is actually going to help the Indian education?
I think doctors do not need any more changes. Only change we need right now is please make sure that the junior doctors are having decent life, happy life. That's the biggest change we are waiting for NMC to initiate and to ensure that change comes. No more changes in the exam required. Already we have got exam over there. It's doing well. Please do something else to bring the quality of life change in the life of junior doctors particularly.
So many students, they directly reflect the NEET PG rank to their success in life. Do you think that you can change that perception?
I was meeting my batchmates, a couple of years back, and I could see people who are missing the college festivals and reading biochemistry hidden in their hostels. They become future Kaddu doctors. You are NEET PG topper and you don't have a smile on your face. You don't have the communication skills. You won't be able to really say that, oh, wow, I'm a very good doctor over there. So ranks do not decide the practice. Practice is decided by the communication skills and confidence you have about the subject, which is not dependent on the rank only.
What do you think are the three biggest mistakes a student does while preparing for this exam?
Number one, most students feel it is one of the activities I'm doing. Unfortunately, it should not be. If you're post-intern, do this only. It cannot be one of the activities. It has to be done diligently. Number two, people start late. They are waiting for the pressure to build up, the steam to build up, then they will really put the pedal on. That's wrong. If you don't start on time, how will you revise? And the third mistake is people do not practice appropriate number of multiple choice questions.
So when doing the NEET PG counseling, even today students are too confused which branch to choose. If you could suggest them something, what would be the three factors that they should consider while choosing their branch?
The single solo factor is you are genetically designed to do something. Everybody is not born to become orthopedician here. Everybody is not born to become gynae specialist here. You are programmed for a certain specific thing. Don't cheat your genetic code. Obey that. If you're not good with the clinical work, choose pharmacology, pathology, and you can do wonderful. After pharmacology, people are doing certain courses and they're getting absorbed into very good companies, wonderful life also. So choose the branch as per your internal design, not to put Instagram story.
Between college, a very good college, not getting your dream branch, and a dream branch with a second line college, what should they
Dream
choose?
branch with the okay college. I'll go for that.
Why?
Branch is a marriage in which divorce is not possible. It will go with you till the grave. So choose it carefully. You can get married on a second level venue also. If you're not getting a very plush venue, no problem. You will always have the opportunity to do SRship and learn the other skills also, no problem. But don't compromise on the branch.
When the student is going for their own counseling part, I believe that they get so many advices from so many people. And I've seen students getting confused because they ask the same question to multiple people. And in the end, they tend to choose something which they did not want. Now, what would be your suggestions to actually tell these students to, be convinced with their own thoughts, which they are not doing? What would be your suggestion?
Hear everyone, then sit alone, internalize the information, and then ask yourself what actually is corroborating with your mental design. Choose that branch only. MD pulmonology may be a good work-life balance if you are not cut out for the emergency medicine, for example. Not that somebody is saying that emergency medicine is wonderful. I want to give you an example. Who are the people who can do emergency medicine better than other people? Nachiket, you'll be remembering, in our hostel days, we used to have two types of friends. One will say, don't call me after 11 p.m. If you disturb me, after that, I can't sleep. Another group of friends, 2:30 a.m. in the morning, you call them, they pick up the call, the first ring only. What happened? We have a fight in our hostel C. You come 2 minutes, wait. On the bike, they're standing below your house. What happened? Like that. And they'll join your fight also. After that, they'll have comfortable sleep also after that. They are the people designed internally for emergency medicine. Please look within. Don't hear too many stories from any consultant, any faculty and all that. You know what you're designed for, what you're designed for also.
That's actually a very good logic behind it, boss. So if I want to ask you that, if I have to ask you this, that what do you think is a 10-year future for ENT as a branch?
Future of ENT.
Future of ENT.
AI definitely will encroach upon certain spaces, but it will make the surgical confidence better. It won't replace the surgeons, but AI is going to help us definitely because we are dealing with a lot of intricate structures, Number two, the 3D navigation is going to get more and more advanced, and the surgeries of skull will get more and more safe. Third, the endoscopic surgeries of the brain through the ear or nose will be more and more rampant. Fourth, we are going towards that possibility where we can put the implant in the various part of brain to make the people hear when the other implants are not working at the moment. That's what we are heading for.
ENT as a branch, do you think that in 10 years, the general MS ENT surgeons, they will vanish and only specialized or super specialized basically, only super specialized surgeons will be there?
Every first year resident who is joining now or have joined should think about a fellowship. It's my humble advice to everyone, because the world is getting more and more precise about what they want. And people have got, Google to search, and they would definitely would like to go to that person who is doing specific job in that area. And it's important to further learn the skill of that particular part to get the more clientele in the future.
Which three specialties, I would say, which specialties do you see booming in the upcoming 5 years?
Again, I say the same thing. If you're passionate about the branch, you'll make it boom for yourself. But if you ask me the trends, the orthopedic is doing amazingly well. You know it because I'm a lot of implants and all that. Number two, I would say the people think the dermatology, the cosmetology part, if you have got the real brain for it, you can make it work in a big way. And third would be the infertility, the IVF sites, and the newer technology in that. People who are investing their time and brain into it, they would definitely make a mark over there.
So you were just telling us that you have to look inside before choosing a branch. So what kind of student should actually choose ENT as their career branch?
Number one, people who are looking for not breaking something and joining that. You are not a carpenter in your mind. It's a very delicate work. Number two, you should be ready to absorb the endoscopic work and the microscopic work also. Third is, it is going to give the space for work-life balance actually. So if you are a person who's looking for a branch in which you get time for both the worlds, this one is for you.
Let's talk about your journey as an educator. 20 long years. I think that's a lot of time. So boss, you have seen our industry, and of course that's also my personal opinion, they grow from an offline, where a small classroom, faculty coming in, to growing to a very big industry in our country today. It's almost what they say 1,000 crores now that industry has grown up to. So what is the main difference you have seen in when you started and where you are today?
Most one difference is technology. We are much better placed as compared to the 2004. The second thing is student requirement has changed. The hunger to learn and absorb the data is increasing now. And the third is, the most important thing is the question practice is changing now. With the apps giving a lot of opportunity to solve the question anywhere. You are in your ward duty, people say, I'm an intern, I can't study. You can solve MCQs. So these kind of technological changes have made the teaching very different nowadays.
Do you feel that some educators today are simply focusing on growing their online brand rather than just their content? The content may be, submissive, but the online brand is too good. Do you feel that?
The content is the king. Howsoever good you may be in social media, at the end of the day, what matters to student is what was the hit rate on the exam day. I will keep the content way, way above than all other things, which is definitely required nowadays. But we should all give the best content to the students. On the INI-CET NEET PG day, they should feel it helped me.
So if a new MBBS student, I would say MBBS student or a postgrad student, wants to become an educator like you, how should they start their journey?
Actually, Nachiket, one thing I must tell you, teaching profession, you cannot really plan too much about it, at least for my understanding. This is one thing, in my case, I can tell you, profession has chosen me. I have not chosen the profession. But if you have a knack for teaching, you can always start doing some activity during PG days. When you're doing PG, you can develop a YouTube channel, you can start sharing your, cases and all that, you can do that. But, it's a gradual process. It takes a lot of time for us to really, get that, confidence into someone that we can learn from. So for teaching, the important thing is do small activity like Instagram Reel, the YouTube shorts and all during your PG days. And eventually you can, jump into it.
Boss, there's a special segment for you. Normally, we tend to just talk about NEET PG, but when I was thinking about you, I thought FMG. Because I think your name is equivalent to FMG benefits right now. You are a torch bearer for FMG welfare, which I believe they genuinely need. What is your opinion about, and this is again a very serious question for FMG students, they are part of a country, yet they are, treated differently. FMGs are always facing the brunt of the medical education rules and laws which nobody can explain, and why they have been put up by government, nobody can explain.
Yeah.
And I have seen you, Sakshi ma'am, Sushil sir, you went to the NMC office. You were the torch bearers for the rights for FMG students, and I applaud that. Why do you think FMGs are treated differently in our country?
There's a systematic approach towards FMGs. First of all, FMGs are not FMGs. They are like internationally trained medical doctors of India only. The most important reason why they're being treated like this is that we don't have clear-cut policies actually. We don't know who is doing internship for 1 year, 2 year, and 3 years. I think they deserve much better treatment than they're getting right now. And this is a common misconception in people's mind that foreign medical graduate students don't have idea about subject. Most of them are well-read nowadays. When we talk to them, they have got like huge liking for the subjects and they want to absorb more data also. The one change I would like to suggest is that NMC should bring a white paper about FMGs. It's a high time we should do that. The do's and don'ts for the foreign medical graduates. Which college you can join, outside which college you cannot join. Let the government tell it very clearly. Later on, it should not be a problem for the students. Because right now also, there's no clarity which institute would be, conforming to the requirement of the country. We need a white paper about the foreign medical graduates covering all aspects of their licensing and examination.
Recently, they put out very different rules for FMG. I think that they will be working for free for 3 years. Why the government is putting up rules without even having some kind of committee for FMGs, somebody to represent them? Because I think if some representatives are there, they will actually be able to voice their concerns, and government might be able to understand the problems in FMG goes through. They just feel that since these are outsider people, if they come back to India, it should be that they should have problems at every step. What does the government needs to understand in these kind of situations?
Most importantly, foreign medical graduates should create one All India FMG association as an umbrella body. That's a mandatory requirement right now. Because we don't have a single body to represent the problems faced by this group of students. Second, this concept in people's mind must be changed. That students studying from outside are not at par with the students studying from India. I have a question to you, Nachiket. Do you think all private medical colleges are same in the country?
No.
No. So I keep traveling to a lot of private colleges here also and outside the country also. Believe me, the level of education is not different over there. So let us stop this kind of, racist kind of attitude in our mind, in our doctor's mind also, and the authorities also, that students studying from outside are not prepared. They are clearing one exam, which is really tough exam. You know it. It's a conceptual exam. And then only they had a license to start internship. So why can't really they be given same respect also?
What would be your suggestions to improve the FMG system in India?
We must make a high-level committee to understand each and every aspect of the problem right now. And that committee must make the recommendation, and those guidelines must come in the form of white paper, which should be the doctrine to govern all the rules and regulations pertaining to the FMG segment.
Well, December exam is going to come very soon now. So what would be your last minute motivational message for these students?
For the FMGs, I would like to say one thing for sure. These 30 days are most crucial thing. Whatever you studied in the previous August, September month, if you don't revise now, that will go waste. So let us increase the number of hours you're studying now. Number one. Number two, please give GTs. Don't run away from GTs. That is the simulation for the exam day. And third, last thing is be consistent till the exam day.
Perfect. So boss, with this, we come to the end of our conversation, but the podcast is not ending right now. We are moving on to our rapid fire round. अब इसके सिर्फ 2 rules हैं. Pehla, you have to be truthful. Second, you have to be spontaneous. You don't have to think.
Okay.
All right. So the questions are coming to you now. So what's your go-to stress buster after a long day at work?
Netflix.
Perfect. What's the most rewarding part of teaching medical students?
The smile of the student who has passed the exam.
If you weren't a doctor, what would you have been?
I would have been a clinical psychologist.
Secret hobby which people do not know about Dr. Dhawan.
Mountaineering.
Really?
Yeah.
What do you enjoy most about teaching?
The whole concept of contributing positively to somebody else's life.
Mountains or beach?
Mountains.
Favorite vacation spot?
Goa.
Nice. What's the most frequent question you get asked by medical students?
I'm feeling anxious.
Okay. What's the happiest moment in Dr. Rajiv Dhawan's life?
When I had my daughter in my hand.
What's her name?
Anushka.
Anushka, you have a great father. And with this, we come to the end of our podcast, Dr. Dhawan. It was a lovely podcast. I think we got everything we had to know about ENT and we learned from the best.
Thank you very much for inviting me.
So thank you so much, Dr. Saab. And thank you so much, guys. I hope every query regarding ENT was solved today. I personally believe it was one of the very enlightening podcasts for us. So if you liked it, please share it with your friends. Do not forget to like and subscribe to the podcast and for the channel. We'll keep on bringing some great legendary doctors. And for that, we just need your support. We'll be launching our next video when we reach 30,000 subscribers. So I'm hoping for a lot of support from you guys. And who do you want as the next guest in our hot seat? Please put in the comment section. Thank you so much and all the best for your exams and the counseling part. Thank you so much.